Hi, this is Mark Graban, and this is either a practice session or it ends up being the backup recording in case something happened and I wasn't able to join you live today. But I really appreciate the virtual invitation to speak to you in Ireland. I really hope to come visit in person in 2019. I'm very much looking forward to that opportunity and coming to see some of the work that you're doing in healthcare improvement. And that's my theme today, is talking about healthcare Kaizen and the idea of engaging everybody in improvement every day. Personally, I haven't had a chance to practice Kaizen or to see things firsthand in Ireland. I have seen these principles and these methods be very effective in many countries in Asia, in the US, and Europe. So I want to share some thoughts with you today. Hopefully you are already practicing some of these methods, or there might be some new ideas here that you can use to build upon your lean approach to improvement, your lean management system or lean improvement methodology. Or if you're not doing that, Kaizen is a great way to get started and to introduce people to improvement, to start engaging them in a way that's positive and encourages more participation. So the word Kaizen is a Japanese word, and don't mean to overdo it with Japanese, but I think this word has particular meaning, whether we use this word in our process improvement work or not. We can refer to process improvement or continuous improvement. There are all sorts of phrases that could be used, but the Japanese word Kaizen has two characters. It translates to mean literally good change, Kaizen, change for the better. And we can step back and think about, maybe reflect upon change versus improvement. How do we know something is not just different, but better? That's one of the key aspects of Kaizen, whether it's measurable improvement or whether a team just decides we just know this is better than the way it was before. But we need to evaluate that and not just push change for change's sake. Now, pictured here is Masaki Imai. He wrote a book that was published in 1986 called Kaizen that introduced this approach, or at least this kind of formal methodology from Toyota and other companies into the Western world. A very popular book. Mr. Imai is still actively traveling the world to this day. And Mr. Imai defines, you can go find a YouTube video of him speaking about this. He says basically Kaizen means everybody improving everywhere and every day. That's the ideal. We might not literally get everybody in every part of the organization every day, but I think that should be the goal. That's the challenge for leaders, is that we can engage people. We know people have the ability to improve their own work at a local level. That's not the only thing we need to do to improve healthcare, but it's a very important piece, engaging everybody, trying to engage everybody everywhere, every day. So Mr. Imai wrote his book in 1986. In 1989, Dr. Don Berwick, who's I think quite well known internationally through the Institute for Healthcare Improvement, he published an article in the New England Journal of Medicine, 1989, titled Continuous Improvement as an Ideal in Healthcare. Dr. Berwick compared healthcare to different types of factories, those with a bad culture that doesn't engage anybody in quality and process improvement versus a good culture. And the difference in these organizations is not the caliber of the workers, it's the style of leadership, the management approach that makes a huge difference. So Dr. Berwick, almost 30 years ago now, was advocating not just for continuous improvement, but was sharing the idea that we can learn from other industries. As Dr. Berwick defined Kaizen as the continuous search for opportunities for all processes to get better. Now, there's more nuance than that, but again, the idea is that we're continuously improving, not improving in an occasional project, but really trying to engage everybody, everywhere, every day. Because part of this ideal comes from Toyota. We visit a Toyota plant in Japan or in Texas, where I live. This is a picture from San Antonio, Texas, where Toyota illustrates what they call the Toyota Way management system as having two what they call equally important pillars of continuous improvement and respect for people. These go hand in hand. It's hard to have one without the other. Because we respect people, we are driven to improve. And the way we actually achieve more improvement is by respecting and engaging the people who do the work. Because it's often said at Toyota that everybody has two jobs. And I've seen healthcare organizations translate this, bring this, or not even a translation, it's just directly bringing this idea into their organization. So we could say everybody at our hospital has two jobs, and mean this in a very positive way. To not just do your work, but to also be involved in improving the work. And that's a very powerful and positive dynamic when we express that belief in people, when we demonstrate our willingness to collaborate with people as leaders, to not have all the answers as the manager or the executive, but to be more of a facilitator and to draw ideas out of people and to help them implement these ideas or to test them in practice. Now, one of my books is called Healthcare Kaizen, and my co-author, Joe Schwartz, is responsible, really the head of their lean and continuous improvement program at a health system in Indianapolis area, Franciscan St. Francis Health. They have a couple of hospitals in that area. And you can see videos that I've posted through my blog. This is a video with two nurses from an endoscopy unit. And you can see they're smiling, and I didn't just happen to take a screenshot of the one moment when they were smiling. They smile a lot because being engaged in improvement can be a very rewarding and fulfilling activity, and you can even work to make it fun. So as these nurses say in the video, the culture here is staff input into everything. They, meaning management, want staff figuring out how to fix things. What can we do to make our job easier? That's a very important starting point. They allow us to implement things to see if it will work. So this is where we're getting to cycles of PDCA or PDSA. We don't know the answer. We go find the answer and we test and evaluate the answer in a scientific way. So at Franciscan, they talk about Kaizen. More broadly, we can talk about 3 levels of Kaizen as practiced at Franciscan and other organizations. This is a diagram that was actually modified originally from Toyota, where we talk about large improvements. These are big, expensive, time-consuming, sometimes risky projects, large projects. We can call that a form of Kaizen, the big circles in this diagram. And then we can have what we call the middle range, rapid improvement events, Six Sigma projects, middle size improvements that might involve root cause analysis. We might use an A3. There's a little bit more complexity and involvement here. And we might have more of those than we have of the large Kaizens, but they're still relatively few, and we're having to select them maybe somewhat carefully. But then the opportunity that a lot of organizations miss, unfortunately, are all of the small Kaizens, what you might call the daily Kaizens. As Toyota people say, see a problem, solve a problem. No projects, no big, long team effort. We're looking for many, many small opportunities for improvement. And there are some researchers that have shown in different organizations that approximately 80% of the improvement benefit in a continuous improvement program comes from the small improvements. So if we look at those small improvements and say, well, those aren't very big, those don't have a big return on investment, those are not important. Well, we miss an opportunity to engage people. We miss an opportunity to help them develop improvement skills. And we miss an opportunity to help bring people up to where they're not only solving small problems, but they're also working their way up to solve medium-sized problems as their comfort and confidence with improvement grows. If we don't engage people in the small stuff, they might never get started. And that's a lot of lost potential to the individuals and their development and to the organization. So pictured here, this is the very first Kaizen that was ever implemented at Franciscan over 11 years ago. Debbie from the housekeeping department noticed quite simply that coffee filters were sometimes getting contaminated or dirty and they had to be thrown away. So her idea was as simple as, let's store those in a plastic container. The benefit is that it's good for the environment. There's a little bit of cost savings. Nobody asked her to write a business case or to charter a project or to look for a root cause of why the container, the coffee filters were dirty. See a problem, solve a problem. This is a really small test of change that took place. I mean, if we used the plastic container and the filters were still getting dirty, we'd realize we haven't really solved the problem. But thankfully here, Debbie did. So this very first Kaizen was part of the spark to build this culture and to get more people engaged in improvement. And if we look at some of their data over the years, Franciscan tracks the number of Kaizens that have been implemented. And 2018 is a partial year number, of course. So you can see as they rolled out this methodology over the first couple of years, there was an increase in participation, and then arguably it's just fluctuating around an average. Some years have more Kaizen improvements than others, but the average looks to be about 3,500 improvements per year that are formally documented in their system. They have a database that helps track and spread and share improvements. They track the percentage of employees who are participating in Kaizen. So even though their ideal is 100% participation, they don't blame the employees who aren't participating. They challenge themselves as leaders to ask, what can we do to get more people involved? Because this number, again, appears to be fluctuating at about a 35% participation rate. And then even though they don't require cost savings for every improvement, they do track cost savings when it's there. And I think they've seen in their experience about 10% of all Kaizen improvements have a measurable cost savings or bottom line benefit. So it's important to track. And you can see they're saving at least $1 million a year, in addition to all the other more important benefits around quality, patient safety, patient satisfaction, and employee satisfaction. So here's another one of their early Kaizens where it was less of a simple just do it. Hope noticed that young children wouldn't lay still and got scared or were crying during an ultrasound procedure. So Hope had been to a wedding, and she had the idea that came from that wedding of, they blew bubbles for the married couple. Maybe we could do the same thing to calm children. Now, this is an example where you sometimes have to brainstorm different ways of solving the problem, or you might go and test multiple possible improvements. We don't just jump to a solution. We don't assume that it's going to work. We might have to do some investigation and make sure that soap bubbles aren't going to cause problems with the equipment or that there's no infection control concerns. That's why they ended up testing and using small single-use bottles. And they tried this and it works, and they still occasionally use this method today. But I think one of the things we see here is the focus on solving the problem. If as leaders, for some reason, if we decided it's unfortunate, but we need to say no to blowing bubbles, we might not like the use of plastic, and there might be a number of legitimate concerns here. But instead of just rejecting the idea, leaders have the obligation to work with employees to ask, what else could we try to solve this important problem? So if we look at the Kaizen process as they've used it at Franciscan, and we've taught to other organizations, we talk about finding opportunities for improvement, discussing them, implementing, or maybe better said as testing improvements, and then documenting and sharing what we did. When we talk about 4 goals of Kaizen, this comes from Masaki Imai, and I think it has applicability to healthcare. We could talk about making things easier, making the work easier, doing the work better, doing things faster, which actually, from a lean perspective, means eliminating delays. Instead of, we don't pressure people to do their work more quickly. We help the work flow better. And then the 4th goal might be cheaper. But again, we're not trying to cut corners. We don't want to hurt quality. Quality probably ties to goal number 2 better. A goal of safety. probably connects to both easier and better. Some have asked, well, why is safety not the first out of 5 goals of Kaizen? If that's the way you want to articulate it, I think that makes a lot of sense, and that would be great. So how do we find opportunities for improvement? It could be as simple as leaders asking employees, what do you think we should do? We can ask people, what bothers you? What gets in the way of you doing your work? What interferes with ideal patient care? But to make sure people aren't pointing fingers at other departments or just bringing up those large concerns, we also want to ask not just what bothers you, but what can we fix? Now, not all problems can be solved within our area. Sometimes the leader has to help escalate problems or initiate an A3 or an improvement that leads to broader, more systematic change. But we want to get people participating on things that are small and testable and things that we can evaluate within our team. So when I've worked with hospitals, here's an example of some of the initial cards that were written down. We can call this a Kaizen card or an idea card in a nursing unit in a hospital. So we write down a problem. And this is very important. We don't just jump to a solution. We start with the problem that needs to be solved. Patients are asking for ginger ale when they're nauseous. It's not stocked on our unit. So the idea is to stock ginger ale on our unit. So the manager might make that phone call, or the manager might teach the employees, here's what you need to do to make changes to our dietary and supplies inventory. The benefits here is that nurses would run around less, or staff would run around less looking for ginger ale, and it would increase patient satisfaction if we eliminated delays and got them what they wanted to be happier and to be less nauseous. So this was a relatively simple thing to go and implement. See a problem, solve a problem. There was very little discussion. They found the opportunity, they discussed it, they implemented what they did. One of the other initial idea cards was a little more complex of a problem. It says that the hand sanitizer foam canisters were empty outside of 2 rooms. So the idea is to improve the process for quickly replacing an empty. So this is where a manager might ask questions or form a team. This might be worth doing an A3 about, to look for a root cause or to make sure we understand the current process before we go testing solutions. So these are some of the first cards that came in. And what we do with those cards, this is a picture from a different setting. I actually did some volunteer work with a charity called Catholic Charities. They, in one of their office areas, put up an idea board as they were implementing this Kaizen methodology. So you start with your new ideas, things that haven't really been talked about yet, things that we are going to do, things that we're currently doing or working on, and things that are done or completed. So having a visual board like this creates a lot of transparency, helps engage people, helps improve communication. So we encourage people to write down cards, put them on the board, and then we ask people on an ongoing basis, what can you do to improve your work? What opportunities do you see? What bothers you? But beyond what bothers you, we can also teach people to see waste, because sometimes people get really used to the waste and the problems in their work. In one health clinic, we taught a podiatrist and the nurses in that team to identify waste. We shadowed, we followed a doctor. We did a spaghetti diagram, as you see drawn out here. This was not all of his walking in one day. This was all of the walking required to gather supplies for one patient in the exam room. Now, this doctor wasn't disorganized, but he worked in 4 different clinics, 4 different days of the week. So each one was set up and organized a little bit differently. And so what the team was able to implement were simple, low-cost, low-risk improvements. They created a cart that they used to keep all of his supplies organized and parked right outside of the 2 exam rooms that he used. They created a restocking checklist that they would use the night before Dr. Serpi came in to make sure he had what he needed. So this improved his productivity. This reduced his frustration. It reduced waiting time for patients. And the other thing that was kind of interesting about this dynamic is that if we go back and look at the spaghetti diagram, This didn't bother Dr. Serpy. He viewed it as, well, I'm just doing my work. This is the way it's always been. He was busy, but we identified that this was not the only way or not the best way to do the work. He was so happy with the cart. His first question was to ask, how quickly can I get one of those in the other 3 clinics in which I work? So this was a very positive thing for him. That's how we engage people and get them participating in more improvement. We make it helpful and beneficial for them. So when we find ideas, we can discuss and then implement or test the ideas. And again, we're trying to use plan, do, study, adjust cycles of not just do, and certainly not plan. At some point, we need to take action. But the amount of planning, the amount of discussion that goes into different improvements depends on the situation. As leaders, when people step up and bring forward problems or opportunities or ideas, we need to stop being a judge of saying good idea, bad idea, yes, no, and instead be more of a coach. We want to be welcoming of all ideas and work with people, because people often ask, well, what happens when we get bad ideas? Norman Bodek, who I've learned a lot from and has written a lot of books about Kaizen, says, treat each idea as a gift. So that whether we want to think about the money or a gift of a cute bear, we don't want to be rude. We don't want to be dismissive of ideas. We don't want to say that won't work, that's a bad idea. We don't want to make a face that implies the person shouldn't have suggested that. So we don't want to just be polite. We want to be respectful. And when somebody has a quote unquote bad idea, that's the starting point for our discussion that helps us find something that can be implemented. And again, we might not be solving the problem completely, but we're making things better and we move on with more improvement. Because there's a good benchmark from Toyota and Franciscan, St. Francis Health, and some of their departments and other organizations I've seen, where they implement 90% of the ideas that come in. Now, that doesn't mean that they implement the first idea, the first solution, but it means they discuss it, they experiment, they test and try things to find something that is a positive improvement, a good change, or a Kaizen. So we might want to provide coaching. If somebody in a lab says, there's a problem, some of our samples, pour-off samples have red blood cells in them, and the idea is to be more careful. Well, we might need to respectfully push back and challenge the team. Well, what does it mean to be more careful? How do we ensure, is it really a matter of not being careful, or do we need to improve the process and maybe use the concept of error proofing to prevent mistakes from occurring? Here's a different example from a hospital where the problem, an important one, admissions from, we'd say A&E, between 5 and 6 in the evening during the shift change report, patients come up and might not be seen in the inpatient unit right away. So that's bad for patient care. But the idea coming from the nursing unit was to postpone admissions until after 6 o'clock, which I don't know if that really improves patient satisfaction. But we might need to push back and challenge, well, is that even possible? Is that ideal? Is that going to further clog up A&E? So again, we find and discuss. And then when we find something that can be implemented, we want to document and share those ideas. So we want to help spread ideas. We want to give recognition to people who have participated. Here's an example from a different hospital I worked with in Dallas, Texas area. If you look at the date, 2014 is when we had an Ebola patient in Dallas. And this is an example from a children's orthopedic hospital. It didn't have an A&E department, but they were still worried what would happen if somebody came with Ebola symptoms. So they had 2 bags. They had a screening kit and they had a separate bag with protective gowns. The idea was, well, why don't we just combine it all into a single bag? This reduced some of the risk that somebody would run off in a hurry and forget something and have to come take another trip back. At Joe's hospital, they did a better job of organizing blood pressure cuffs so that it would save staff time not having to dig through and making it easier to do the right work the right way. But it's not just about organizing things. We can engage clinicians in clinical improvements. This is an example in an emergency department, improving the way X-ray order sets were done to prevent unnecessary or incorrect orders. So this is the key. We want to engage the people who do the work, regardless of what that work is. Housekeeping, nursing, surgery. Everybody can be involved in improving their work to that goal of everybody, everywhere, every day. So we document these Kaizens. We share credit. We give recognition. We might post them on a wall. Here's an example from a hospital lab in Dallas. When we post ideas, people might walk by and say, that's a great idea. We're going to use that in our part of the lab as well. We can use electronic databases to spread and share ideas across departments or across sites within a region. This hospital lab really did a lot to create their culture of continuous improvement to the point where you wouldn't know by looking at it, but this one Kaizen here, Lisa, was a medical technologist in microbiology. On her very first day, she implemented a Kaizen because they made it part of the orientation for new employees, setting this expectation that you are going to have what we call fresh eyes to see things differently. We want you to point out problems. We want you to challenge the way it's always been done. I want to share with you, and I'll link to this on the webpage for my presentation today. Greg Jacobson is an emergency physician. He published a journal article, as you see here, Kaizen, a method of process improvement in the emergency department. Greg engaged doctors in improving the important work of emergency medicine. And in his journal article, he highlights some of the key Kaizen principles. So it's not just this broad idea of continuous improvement. It goes beyond engaging everybody, everywhere, every day. But it's a matter of, well, how do we engage them? No idea is too small. Focus on common sense, low cost, low risk improvements. We want to empower workers to not just come up with ideas, but to actually test and evaluate changes to see if they are changes for the better. And this other key here, all ideas are addressed to and responded to in some way. So before Kaizen, we might have a lot of frustration, or people have just become numb to the problems that they're dealing with on a daily basis. What a Kaizen culture looks like, I would argue, has many more smiles. People are making their work easier as they're proud of what they're doing. You can see the engagement and the satisfaction on their faces. This leads to better patient care and better results for the organization. So the staff are critically important, but so are managers. Jamie Bonini from Toyota says it's a manager's role to develop people so that they can surface problems and solve problems. And that leaders need to create an environment where this happens. So again, if people are not participating in Kaizen, don't blame them. We need to figure out how to lead and engage people differently. As somebody said at one of the hospitals I worked with, this is the best thing we've done in my 20 years. We're finally fixing things. And that's the opportunity we have in healthcare. If we've ignored small problems, if we haven't engaged people in solving those, we have a huge opportunity for improvement and making our health system and our hospitals better. So how do we get started? I'm going to challenge you at some point, just start. Don't overthink it. At some point, think of plan, do, study, adjust cycles. Go try this approach, see what works, study, and adjust. So I'm going to ask you maybe to commit to these actions. You can download Kaizen cards from our book's website, hckaizen.com. Fill out a Kaizen card yourself as a leader. Ask others to fill out the cards. Help people find time to test ideas and share improvements with each other. That will help get the process going and will help you build momentum. So with that, thank you. I would love to hear your questions via email or Twitter. If you want to download the slides and see links to the videos from Franciscan, books, Greg Jacobson's article, all of that, You can find that at markgraban.com/Ireland 2018. So again, thank you for the invitation. I sincerely hope this is helpful to you, and certainly wish you the best in your ongoing improvement work. Thank you.